Hello, I'm Dr. Gayatri Pegu. I am a DM Nephrology. I am an assistant professor in the Department of Nephrology, Guwahati Medical College and Hospital, Guwahati, Assam. Today, I'll be going to tell a few things about CKD or chronic kidney disease. CKD is one of the most dreaded conditions that we encounter. It's a progressive disease which is increasing in the society, and almost it affects more than 10 population. So you can say that almost 800 million population worldwide are affected with CKD or chronic kidney disease. The bad thing about chronic kidney disease is that it's a progressive disease. And if we don't intervene early, it keeps on progressing in a very rapid rate, and it's ultimately cause suffering and mortality in the general population. Now, uh, why does this CKD occurs? Why the people get affected with CKD or chronic kidney disease? So it was seen that most of the patients who have CKD are those who has got pre-existing diabetes or hypertension. That means the person who has got diabetes or hypertension, high blood pressure, they're more prone to develop chronic kidney disease. And other than that, there are a few other conditions also where a patient can develop chronic kidney disease. Like there are certain conditions of the kidney, certain we call them as glomerular diseases. So for that reason, the patient may slowly go on to develop chronic kidney disease. Other than that, if the patient has got kidney stones, and those are in the earliest part, then they can go on to develop chronic kidney disease. Apart from that, if there is intake of certain medicines, painkillers from a long time, or intake of certain drugs, herbal medicines, which composition we don't know, then this all can lead to chronic kidney disease. Now, why chronic kidney disease is important is because it's a progressive disease. It cannot be cured, unlike in certain infectious diseases, where by giving a treatment, we can stop the disease or prevent the disease. In this chronic kidney disease, once it starts and it keeps on progressing relentlessly until and all the patient develops end-stage renal failure or CKD stage 5, where the patient can survive only by means of dialysis or renal transplantation. So if it's not detected early, we cannot prevent its progression, and ultimately the patient is led up into ESRD. Now, why detecting the disease early is important? Because unlike other diseases, the patient have any symptoms of CKD in the early part. So it's only with investigations we can find out the cause of CKD. This CKD patient in their early part, they don't have any signs or symptoms which can for which the patient may go to a doctor or meet a physician. So by the time a patient develops symptoms of chronic kidney disease, it's too late, and the symptoms are very vague. Pinpoint a particular symptom to that chronic kidney disease. The patient may present with symptoms of abnormal urine. They may problem with urinary problems, like they may have decreased urine output, or they may come with a frequency of urine. They may come with complaints like they are passing multiple times in the night, or they may have to complain of having passing foamy urine, or may complain of swelling of fits. They may complain of tiredness, weakness, symptoms of breathlessness. So these are very vague complaints for which a patient may not know that he is having any kidney trouble. So, and by the time the patient gives these symptoms, probably it's too late. So what we can do is that to diagnose a kidney disease, a few tests are required, are done in laboratories, in almost all the laboratories, and in small cities also these tests can be done. And these tests are mainly blood test and urine test, from which we can diagnose if a patient is having any kidney disease. So these are the tests of urine. In urine, we see if the patient is having any passage of protein in the urine. And the second thing that we test is the creatinine, or the kidney function test, or creatinine. Creatinine is a simple blood test, is a marker of kidney injury. And from creatinine, we can find out the GFR, or the glomerular filtration rate. That is the functional status of the kidney. These are two tests only from which we can say that if a patient is having any kidney problem. Other than that, we can do a routine ultrasound. From an ultrasound, we can see if the kidneys are of normal size or shape, if the kidneys had got any stones or cyst, and thereby you can diagnose if the patient has any kidney problem. So these are basic tests which can be done in any good laboratory, and from which we can come to a conclusion. Now, in which group of patient will do this test? So as I have said, that one of the most common cause of chronic kidney disease is diabetes. Other than there is hypertension. So any person who is having diabetes, he should undergo this test on a very routine basis, or almost 3 months, 6 month interval. They should routinely undergo this urine test to see if they're passing any protein in their urine, and they should do their blood test to see if there is any increase in the creatinine level. Other than that, patient who has got a family history of any kidney disease, if somebody in the family has some kidney disease, then there's a high risk that the other family members may also develop those type of kidney disease. So it's better that if those patients also undergo tests, this basic test. Also, it has been seen that elderly population, more than 60 years, this group of people are more prone to develop kidney disease. So if a person is more than 60 years old, they should also get screened for kidney diseases. And if there is any history of intake of some Ayurvedic medicines or some over-the-counter pills, painkillers for a very long-standing time, then they should also undergo test. Also, those patients, if there is any infection, urinary infection, recurrent history of any stone diseases, they should undergo kidney test too, and to see that if the kidney functions are okay or not. Now, how do we treat these kidney diseases? So as I have said, the most common cause of kidney disease is diabetes and hypertension. So for well-controlled blood sugar, well-controlled hypertension is the key to prevention of kidney disease. So if my BP is well controlled, my sugar is well controlled, then to a large extent I can prevent the progression of my kidney disease. Even if somebody has a kidney disease, that doesn't mean that's an end to life. By adequately treating it, we can prevent the progression and can to some extent delay the progression of the disease. We have to, in case of if a diabetic patient has developed kidney diseases, then we have to go to a nephrologist and get tested, and also you have to see if there is any alteration in the medicines that needs to be done, because there are certain medicines which you cannot, certain medicines of diabetic medicines which you cannot take if you have got kidney problems. So once a patient of diabetes develops kidney disease, then he may have to change his medicines, the normal usual medicines that which he is taking. Also, the antihypertensive medicines which he might be taking may not be good after the patient develops a kidney disease, so he might have to change that. So those things needs to be taken care of. Also, we have to take care of and we have to maintain a healthy lifestyle, because it is seen that to key to a good life is a healthy lifestyle. So we have to do our exercises. We have to do at least 45 or 5 days a week minimum physical activity. Also, we have to keep our diet. We have to maintain our diet. We have to see that we don't take too much of protein, too much of salt in our diet to prevent kidney disease. About the water intake, see that the water intake is optimal. It should not be very too much, or it should not be too less. There's nothing like taking too much of water is good or taking a little amount of water is good. It should be individualized. And if a patient is having swelling of legs and has got advanced kidney disease, then probably you have to restrict. As I was saying about lifestyle modification, we have to maintain certain changes in our diet. We have to make a healthy living, healthy lifestyle. We have to make some adjustment regarding our diet. We have to reduce our protein intake. It has been seen that increased protein intake per day body weight. So according to a body, should be around 0.8 gram per kg per day. And about the salt intake, that salt intake also has to be reduced. So the salt intake, optimal salt intake would be less than 2 gram per day. So it has been seen that this increased protein and increased salt, these are associated with hypertension. This is associated with proteinuria. This is associated with fluid overload and also progression of the kidney disease. So ideally, we have to reduce the intake of protein and salt. And in most of the situation, this salt or protein is in the hidden form. The intake of frozen food items, this intake of some bakery products, all this contains a lot of salt. So we have to reduce the intake of salt. And as I have said, that most of the drugs are metabolized or are excreted by the kidney. Our kidneys the main function of our kidney is to cause removal of the waste product from our body and extra water from the body. So if our kidneys are weak, then we have to take care that we don't give anything to in our body which is likely to cause, which will make our kidney to work more and to remove those waste products. So any drugs or anything which is not safe for the kidney, we should take care of that. And a CKD patient should ensure that whenever he visits another doctor for some other ailment like some headache or some toothache, then he will be prescribed some painkiller. So he should inform his physician that he has got a background kidney condition, so that the physician can at least give him a drug which is safe for the kidney, because painkillers, most of the painkillers have been found to have kidney toxic effect, nephrotoxic effect. So Those are the few precautions that we have to take to prevent the progression of the kidney disease and lead a healthy life. Thank you.